Hello everyone, my name is Teresa C. Quinto and I am here to present to you my strategic plan, which is to decrease the nursing shortage at the University of Wisconsin Hospital and Clinics. UW Health University Hospital is a 505-bed academic regional referral center with 125 outpatient clinics located on the western edge of the University of Wisconsin, Madison's campus in Madison, Wisconsin. It is verified as a Level 1 trauma center by the American College of Surgeons, and it is also a magnet-designated hospital. I will present to you the why and how of my strategic plan. The why will cover the mission and vision of my organization and a SWOT analysis, and the how, which will cover the strategic goal, stakeholder support, strategy map, action plan, communication plan, and evaluation plan. With nurses as the foremost champions of the University of Wisconsin hospitals and clinics to advance healthcare without compromise through service, scholarship, science, and responsibility, we undeniably live the pledge of providing patient and family-centered care across the cycle of health and illness through our actions, decisions, words, and achievements. We are dedicated to continuously enhance our care through profound professional growth and development. As a magnet organization, UW Hospital and Clinics have adopted the vision and principles to support the organization's vision, which is remarkable healthcare, and by working together, UW Health will be a national leader in healthcare, advancing the well-being of Wisconsin and beyond. A SWOT analysis was conducted to determine the strengths, the weaknesses, opportunities, and threats. Nurses are an integral part of the healthcare system and is one of the largest fields of the healthcare profession. Despite being one of the fastest growing occupations in the country, the shortage of nurses will continue to increase. I believe that through a SWOT analysis, my organization will gain more awareness on the need to improve nurse retention and nurse turnover rates. The strengths of my organization includes highly accomplished practitioners with extensive knowledge about advanced diagnostic and therapeutic modalities. Adopted a professional practice model throughout the organization that emphasizes the sanctity of nurse-patient relationship. We have advanced technology across the system, flexible nurse staffing actions, which include casual, weekend, full, and part-time employment. We are also well known for being a magnet-designated organization by the American Nurses Credentialing Center. We have a strong nursing council structure, inclusive career ladder. We offer endless opportunities to grow and develop professionally while gaining tenure within the organization. We have a diverse workplace population. And lastly, we continue developing the nurse residency program. The weaknesses include nursing shortage, high turnover rates on several nursing units, and potential causes are acuity, unit leader, mandatory overtime, high nurse-patient ratio, work schedule conflict. Minimal or no frontline staff accountability for patient outcomes. Inadequate support from management, technology growing faster than education users, limited formal pipeline for nurse leader roles such as nurse managers, supervisors, unit director, care manager, and informatics. Aging workforce, especially in medical and surgical care management, creates greater demand for more nurses. Opportunities include personal growth opportunity for nurses, the impact of financial climate, especially with high nurse turnover, pipeline of advanced practice nurses, nurses serving the community, grant and scholarship programs to advance career, encourages more research into effective staffing methods, creates increased job opportunities for nurses, increase wages or offer sign-on bonus to draw and retain more nurses, more training and education opportunities, incentives for nurse educators, and to be an advocate on legislation related to professional practice. And the threats are healthcare policy changes, aging nursing workforce, the effect of the Institute of Medicine Future of Nursing recommendations, changes in payments and reimbursements from Medicare and other commercial insurance companies, existing nursing shortage due to high nurse turnover rate, cost of legislation and lobbying, the aging patient population, and the national healthcare reform. Our strategic goal. The nursing shortage is a burgeoning problem in the healthcare industry today as hospital leaders are recognizing and experiencing difficulties retaining and recruiting new and experienced nurses. The cost of turnover can have a profound impact on the diminishing hospital margin and needs to be addressed. Hospital turnover is on the rise, and hospital executives need to be concerned since this is a leading indicator of future financial pressure and patient and employee satisfaction. For 2020, hospitals like the University of Wisconsin hospitals and clinics are looking to improve retention rate and have set a goal to reduce turnover rate by 3% on average. The following are specific strategies to be achieved by 2020. First is to improve margins. The University of Wisconsin hospitals and clinics need to control labor costs by decreasing reliance on travel and agency staff. Second is to bolster recruitment initiatives like offering sign-on bonuses and offering competitive wages. The third is to improve staffing ratios by implementing an acuity-based staffing system. And the last is to develop programs that will enhance and maintain a personal and professional life balance for nurses, like flexible work schedule. It is important to get support from stakeholders. The nursing shortage is causing staffing problems in almost all healthcare organizations today. Nursing does not function in isolation, but it is just one piece of the overall healthcare delivery system. Thus, when nursing numbers fall short, the impact can be felt across the whole spectrum of the healthcare system. Because of this complexity, there will not be an easy or single solution. Correcting the shortage will require strategies that will travel various paths and the coordinated efforts of many internal and external stakeholders. It is only appropriate to utilize a stakeholder analysis to systematically gather and analyze qualitative information to determine whose interests should be considered when developing and/or implementing policies, programs, and change initiatives. Internal stakeholders. These are individuals or group of people that participates in the management of an organization and are important to the organization's change initiative. They include the senior executives, the chief nursing officer and hospital administrators, nurse managers, nurse supervisors, and clinical team leaders. Also nurses in the different departments of the hospital that provides patient care, physicians, and other allied health professionals. For the external stakeholders, a healthcare organization must respond to many external stakeholders, and the relationship between them is a symbiotic one, as organizations depend on them for its survival. These are hospital patients and their families, financial stakeholders who have an interest seeing the organization succeed. Also, different suppliers and vendors, insurance companies, communities the healthcare organizations serve, various pharmaceutical firms, and also individuals or companies that are alliance partners of an organization. A strategy map. A strategy map is used to leverage and improve the nursing shortage to help my organization and nurse leaders to retain and recruit new and experienced nurses. Each perspective of the strategy map are crucial to the achievement of goals and overall success of the organization. The financial perspective. The goal is to decrease the nursing shortage through nurse recruitment and retention, thereby reducing costs for hiring experienced and expensive workers such as contract and agency workers, increase profits, and increase in target revenue from reimbursements from Medicaid, Medicare, and commercial payers. Customer perspectives. The goal is for healthcare organizations to improve patient outcomes and increase patient satisfaction by providing high quality and compassionate care, which can be done by providing adequate staffing ratios. Internal perspectives. The goal includes to improve internal efficiency by creating programs that will improve patient health outcomes by expanding access to care. The next one will be to improve partnerships and build strong collaboration with community stakeholders. And lastly, to improve resource management and administrative resources by producing, analyzing, and acting upon performance data through the support of the senior executives and board of directors. And for the learning and growth perspectives, it is through transformational leadership and shared governance that nurses will be able to participate in the decision-making process. For the action plan, I included the internal stakeholders and external stakeholders. For the internal stakeholders, I will utilize management by objectives, which is a system whereby managers and staff members can define goals for their departments and monitor subsequent performance. This includes training and education of all senior level management to ensure they fully understand the effects of the shortage and develop decisive efforts to create the most influence on the retention of staff. For the external stakeholders, I will utilize management by means, which is an approach that focuses people on considering the means rather than just reaching on the goals. This will be conducted through informal conversations, meetings, and getting feedback as to where improvements can be made. I will also utilize the competitive advantage plan, which is to hire qualified and experienced staff members, to have a contingency plan, which is to form a float pool of nurses when unit or staff nurses are sick, on vacation, or on leave. And the last one is to have an action plan, which is the standing plans. This is to establish policies and procedures and have a system in place that will aid in the development of more effective staffing model or matrix, especially for adequate staffing nurse-patient ratios. Communication plan. This nursing shortage is not merely a nursing issue alone, but it requires a collaborative effort among nurse leaders in practice and education, healthcare, executive, and the media. Nurse leaders, together with the senior executives of healthcare organizations, are now challenged to find solutions to address the negative impact of the nursing shortage. A strong and stable communication plan ensures information is being disseminated adequately at all levels of the organizations. This will include upward communication, quarterly meeting with leadership, promote retention of nurses through shared governance, and the administrators to help staff identify new satisfiers that will enhance personal and professional development. For downward communication, the nurse manager department meeting and huddles and staff meetings. Encourage the practice of autonomy on patient care and operational decisions. And also, for my organization and other healthcare organizations to provide recognition and rewards to all staff members and especially nurses. And lastly, the horizontal communication will include interdepartmental meetings with various stakeholders. We will also use emails, intranet, posters, and social media. Evaluation plan. The last phase of the process is to step back, monitor, and evaluate once the strategic plan is in place. Some of the evaluation tools that my organization will use is the employee nurse turnover rate, This will evaluate staffing and turnover statistics, which will provide an analysis of standardized exit survey data, use research literature, review of industry practices in healthcare and private sectors. We will also use the National Database for Nursing Quality Indicators, which compare measures of nursing turnover against national and state norms. Another is the RN Recruitment Difficulty Index, which measures the average of days it takes hospitals to recruit an experienced nurse. And lastly, the inability to fill RN positions, which can lead to higher vacancy rate. This ends my presentation about my strategic plan on decreasing the nursing shortage. Thank you very much for watching, and please feel free to ask any questions. Thank you very much and have a nice day.